shin splints doesn't necessarily mean you need to take a full year off of running. See, most runners get stuck in a cycle where they rest, restart, and then the pain returns again. And it can be frustrating thinking, oh, maybe running's not for you. Maybe you're not built for running. And the real issue is that it's not that it's your body, that keeps breaking down. It's your training approach. I'm Dr. Ray Peralta, physical therapist and run coach. And over the past 10 years, I've helped hundreds of runners get pain-free and get back to training, whether doing marathons or anything in between. And in this video, we're going to discuss how to fix shin splints and prevent them for good. So the big problem, why runners keep getting shin splints, right? It's an overuse injury from repetitive stress on the tibia, the shin bone, right? And usually too much, too fast, too soon, right? So you can see running injuries. Why do they happen? Go look at the image, right? People increase the speed, or they go high mileage, right? Or they do too many days of the week of running, right? And they oftentimes ignore early pain, which can lead to stress fractures. Or they keep pushing through it, and then once a stress reaction becomes a full-on stress fracture. And many runners are seasonal. They'll, just train for one race a year. They stop, start, and they're also in this re-injury loop because they don't keep their body conditioned year round. They kind of decondition, then try to build up the conditioning again, and then they put themselves in trouble too, especially if you're someone who works like a desk job, you have a sedentary job, and then, once or twice a year, you try to ramp up your activity all of a sudden to like train for a marathon. I see this all the time during the spring and the fall. People got either a spring marathon or a fall marathon. And then many folks adults who take running, end up training for the marathon. I get it to popular distance, but then become obsessed with high mileage. Like, I have to run 60 miles a week. And then their body's not able to handle that mileage, or they have poor recovery, and they also end up breaking down. So if you want a copy of this Google Doc to learn more about running without shin splints or injuries in general, check it out in my free school community for runners, link in the description. So a big shift, right? You don't need high mileage to run well. In fact, I'm a big fan of just doing 3 runs per week. And to me, I found that to work better for myself and for my athletes versus trying to run like 6 or 7 days a week with constant fatigue, not enough recovery. And you can also do a low mileage approach, right? You can actually do like 30 miles a week and train for a marathon. And no, it's not just for beginners. I've personally ran like a 3:27 marathon. I've also had athletes who run a 3-hour marathon with just 30 miles a week, right? Because you have more time for recovery, but also more time to do strength training, right? This is the biggest thing. A lot of runners skip strength training or don't do it altogether. And we're going to talk about that in a bit. But also recovery is what allows the tissue adaptation, right? It's because especially if you're running every day, if you're doing recovery runs, are you truly recovering if your legs still feel sore and beat up? Now, are there really elite runners who can actually do a true recovery run? For sure. Very advanced runners, definitely. But I found most beginner or intermediate runners are better off skipping the recovery runs and actually having true recovery days from running, doing cross training, right? It's about training smarter, not just more. Actually having true recovery from running so your body can actually recover and not be predisposed to these overuse injuries like shin splints. So rebuild your foundation. So walk before you run, especially if you're currently injured, right? If you have like pain that's causing you to limp, you're having severe pain. You see this pain traffic light guide, like your pain's like a 7 out of 10 or greater, right? You may have to take a temporary break from running, right? I know people, a lot of runners have a hard time taking a break, but if you're in that much pain, that it's severe pain, you may have to take a few weeks off. You may take a full month off. Hey, can you get to just be able to walk comfortably, pain-free? Are you able to walk comfortably for at least 2 weeks? Then you could transition to maybe like a run-walk program, where maybe you run for a minute, walk for 2 minutes, or if that's too much, maybe even run for 5 or 10 seconds and then walk for the rest of the minute. You have to understand that running is a high impact sport, even though it's not contact. It's not like boxing or wrestling or football where you're making contact with another athlete on the sport. But it is a high impact sport every time your foot hits the ground, right? Because essentially it's a series of single leg hops. So it's 2 to 3 times body weight every time your foot hits the ground. So if you skip this gradual progression, right? So many times people who are currently injured, like dealing with shin splints, they go, I'm just going to keep running, pushing through it, and they keep overloading, and then the shin splints return, right? They let the pain keep creeping up and up and up. Now, if the pain's very mild, again, you can oftentimes work around the injury. If the pain's like 3 out of 10 or less, you can oftentimes do a run-walk method. Again, but even run-walk, be careful with overdoing the run interval. Take it at an easy pace. And then over time, you can build up the tissue and get back to continuous running. So talked about the run walk progression already there, but essentially you start very low, like a small portion, right? I mean, again, it might be just a minute or just 10 seconds. And then over time, you decrease the walk portion and increase the run. So maybe you progress to like 5-minute run or a 10-minute run with a 1-minute walk. The thing is, you don't have to give up the run walk method. You actually complete the run walk, even for a marathon or ultra. There's even people who run like around a 3-hour marathon doing a run walk method. I know it's wild, but you can actually still run pretty fast during a run walk method. But the thing about the run walk method for injured runners is that it removes excessive load while rebuilding capacity. So next, you want to control your training load. Avoid aggressive jumps in mileage or intensity, right? Don't increase your mileage or volume, right? That's your total distance you've ran in a week, more than 30%. I mean, that's a wild jump. But I would also say that your longest run in the past 30 days shouldn't be more than 10% of your longest run, in the past 30 days, right? So like if your longest run was 10 miles, you shouldn't be like jumping right to 15 miles in that 30-day period. Right? It should be a slow, gradual progression, right? And also change surfaces. Like if you're always running on a road, maybe consider running on a trail, a dirt trail or grass, or you can go on a treadmill or a track with rubber, right? Less pounding and less tibial stress. Oftentimes just switching from like hard concrete or switching the surfaces can make a big difference as well. And then fix your running form. Common issue is overstriding, right? This is where your foot reaches out too far in front of your body. So this leads to excessive braking forces and stress on the shin. A couple fixes are increasing your cadence. So let's say, if you're running 160 steps per minute, maybe increase to 170 or even 180, right? Land, try to get the foot a little closer to the body. And progress towards a midfoot strike if appropriate, if it works for you. I know some people prefer to run heel strike, but as long as you're not overstriding, it's really overstriding that's the bigger issue, which causes too much of a braking force on the leg. And then strength training, right? Focus on durability, not just running more. So train the hip abductors, your glutes, control pelvis, reduce stress. Also train your calves, your gastroc, calf raises, but also train your tibialis anterior, right? Support your shin and for control, right? Some exercise, the lateral band walks, single leg bridges, right? Talked about calf raises. You could do straight knee, bent knee, soleus raises, tib raises, heel walks, toe walks, front planks, side planks. This is where most runners fail. They skip strength training or they do it, lightweight, high repetition and not enough to actually stimulate tissue adaptation, right? So do appropriate progressive strength training 2 to 3 times a week, and it's going to make a big difference in how strong you are and durable for running. Mobility, right? Also making sure you're mobilizing tight or restricted areas. Oftentimes runners with shin splints have tight calves or poor ankle dorsiflexion mobility, which leads to higher shin strength. So make sure you restore ankle dorsiflexion, but also big toe. Big toe is very important too. Also make sure you have good big toe extension mobility. So you want to improve, typically it's ankle dorsiflexion, big toe extension. And you want to spend at least 10 minutes per day mobilizing your tight restricted areas, especially around the lower legs. But sometimes you even have to work on the hip as well, because the whole kinetic chain up and below the chain can affect the shin. So better movement equals less compensations and less stress on your shin bone and your tibia. So a realistic recovery timeline, about 6 to 8 weeks. Most folks can go back to run walking like 3 times a week. And then around like 10 or 12 weeks, majority of folks can get back to continuous nonstop running and then go on to base building or going on to train for a half marathon, etc. But rushing leads to setback. So it's better to be consistent. Take your time, go through the run, walk, interval progression, do the strength training, and then most of these injuries do heal. Now, if you're not getting any better at all, like you have severe pain, it's been lasting more than a week or so, right? Definitely go get that checked out. Work with a doctor, work with a medical professional. For the rehab side of things, for physical therapy, ideally work with a physical therapist who also understands runners, so to help you finally get back to running pain-free. So I currently have 2 spots on my schedule to help runners get pain-free for private one-to-one coaching. Book a free consult call. First come, first served basis using the link in the description. So the big picture, shin splints aren't random. They're usually a training error problem. The fix is, going to a low mileage approach typically, you're running just 3 days a week, doing strength training 2 or 3 days a week, working on your form, your mechanics, recovery, mobility, and do this right, and you could come back stronger than before. So if you found this useful, like, comment, subscribe, and I'll see you on the next one.